So welcome to the latest edition of Health Matters. This one focuses on obesity and the food environment. My name is Dr. Alison Tedstone and I'm the Deputy Director for Diet and Obesity here at Public Health England. Obesity is a global concern and it's also a national concern here in England. Obesity causes a complex series of health problems that affect us now and going forward as we get older. This is primarily because we're living in an obesogenic environment that encourages us all to eat more, gain weight, and over time become obese. Eating out of home is no longer a treat. It's an everyday part of most of our lives. This contributes significantly to the extra calories and sugar, fat and salt we are consuming on a daily basis. Local councils are already working hard with local businesses, and PHE is committed to supporting councils to put evidence and practice into action to change the food environment and make those healthy choices the easiest. That will help our children and help families. So as part of PHE's whole systems approach to tackling obesity, PHE has partnered to develop strategies for encouraging healthy eating out of home and has provided a food kit that we hope will inspire and support local councils to take action and build on what they're already doing. So we have a call for action to encourage individual businesses to implement simple changes that will make it easier for children and families to choose healthy food. So with me today I have a panel of experts who are going to discuss these issues. Can I ask you to introduce yourselves?
Hello, I'm Jenny Morris from the Chartered Institute of Environmental Health, which is a professional body for environmental health. Many of our practitioner members work in local authorities and are key players in this activity.
So Sue.
I'm Sue Bagwell. I'm from London Metropolitan University, and we've been doing a lot of research on the out-of-home food environment, fast food businesses and so on over the last few years.
And I'm Nicola Machiavelli. I'm Head of Nutrition at the Children's Food Trust, and I've been working with Public Health England and the Chartered Institute of Environmental Health and London Met to put this toolkit together using the expertise around school food.
Jenny, can I start with you please? Can you explain the work with PHE you've done to develop the toolkit and how you've brought the evidence together and how it will assist local authorities?
Certainly, I think it's worth starting with what the toolkit covers. It is about out-of-home eating, which means, I think fairly obviously, places like takeaways, fast food shops, sometimes restaurants, but also it involves places where children and families go. That could be leisure centres and it could be vending machines. There's a whole range of things in this toolkit. Because what's very clear about tackling obesity is there is no one answer. And what we need to do is look at the evidence of what can make a difference. So the base of the toolkit is a literature review which pulls out the evidence of what can help to improve the kind of food that is eaten out of home and actually makes a difference. So it's not theory alone. What it has to have is practice, and what people will see when they look into the toolkit, it's a step-by-step approach to building an intervention that is suitable for the local circumstances. That pulls on the evidence, but it also pulls on practice that's worked in other places.
Thank you. So Sue, turning evidence into action, how can you overcome barriers for change and build on opportunities?
Okay, well, I think if you want to encourage businesses to make change, I think the golden rule is to actually understand their perspective. Many of the sort of businesses we're talking about here are actually working in very competitive environments and are very cautious about actually increasing their prices or doing anything that they feel might deter their customers. So if you're designing an intervention, you need to actually incorporate changes that are going to be easy for them to make and that they can see are not going to impact negatively on their prices and the profitability of their business. So it could be simple things like actually reducing the size of portions, which would actually save them money and which could be done fairly gradually so that customers don't actually notice and complain, that are likely to be far more acceptable to businesses. Or even if they introduce some healthier options, it may actually bring in new customers and generate more income for them. The other thing I think it's important to understand is that businesses are also constrained by the nature of the supply chain, and that many suppliers actually charge more for healthier products. And we've got some interesting examples in the toolkit where local authorities have worked with suppliers to try and encourage them to change their marketing and pricing strategy to make it easier for businesses to actually purchase the healthier ingredients. The other tool that local authorities can use as a lever is to look at businesses that occupy premises where the local authority owns the building or leases it, and they can incorporate perhaps clauses into the lease to food businesses which actually stipulate that the business must sign up to a healthier catering criteria. And that's increasingly being done now in a number of areas, particularly leisure centres and other council-owned premises. And the toolkit outlines a number of strategies like this, which actually can encourage businesses to make changes and make it easier for them to make changes, really.
So Patricia, can you tell us a little bit about what the role children and families and schools are in this?
Yes, absolutely. Well, we really want to make sure that children have access to a healthy, balanced diet so they can grow and develop well. And so what we want to do is make sure every opportunity where they are faced with food, whether it's at home, out of home, school, or in childcare, that they have access to a healthy, balanced diet. Schools have a massive opportunity here because obviously they've got 2 decades of interrupted contact with children and families. So it's really important that they role model those healthier choices, and we want them to adopt this, what we call a whole school approach, right through their education, and every opportunity, whether they're having breakfast there, mid-morning break, after school and lunch, we want to make sure that the food that's served there is healthy.
So Jenny, turning back to you, what role can different parts of the council play in this?
I think it's fairly well recognised that councils set standards in public health, and they've got lots of different departments that do this in their own ways. But it's also becoming clearer that to tackle something like obesity, we actually all need to work together. So I think with the move of public health into local authorities, you're beginning to get some interaction between public health and environmental health, and that shows in some of the case studies, but I think it could be better. But it goes much broader than that. We can bring in trading standards, we can bring in planning, we can bring in economic development and others. It has to be a collaborative effect, and they've all got different levers, so they can do different things.
Patricia, can you tell me about what schools have done?
Absolutely. The schools have, since 2006, been following mandatory standards for school food, and they specify the types and amounts and frequency different foods should be provided. So we've used some of those and to inform the healthier catering guidance that's gone alongside this toolkit. So things like in schools they have to provide a portion of fruit and vegetable at lunchtime, and we're suggesting they do the similarly in food outlets as well, promoting the cost, for example, of fruit to be cost lower than a sweet dessert, for example, and making sure that they serve a portion of vegetables. Likewise, the school food legislation helps to limit the amount of fat, saturated fat, sugar and salt. So it actually reduces the frequency that these types of foods that would be provided, or it actually says not to provide them. So confectionery and snacks with added salt and fat aren't permitted in schools, and salt shouldn't be available for children to add to their food. Likewise, we've suggested in the toolkit guidance for the healthier catering that the salt shouldn't be provided in these food outlets. We can also learn around the new legislation that's come in for schools around healthier drinks. So this was brought in January 2015, and we've limited the portion sizes of fruit juice, for example, to 150 mils, and for the combination drinks with the water and the fruit juice and the milkshakes to 330. Likewise, we would want to try to encourage the food outlets, particularly those where frequented by children, are following similar kinds of guidance. This is really important so that children get that healthier, consistent message around what is a healthy, balanced diet.
Thank you. So, Sue, can you just explain where a council should start? Where would you advise them starting?
Okay, well, I think to begin with, ideally, I think you need to have a detailed understanding of your local food environment. And I know resources are tight, but if you've got some resources, try and actually do a little bit of research, map out the businesses. This should be possible from the local food register. Look at how they relate to other kind of key local community facilities like schools, community centres and so on. Try and understand who their consumers are, and look at the area that you actually want to intervene in, perhaps where obesity levels are highest or where there are local schools and so on. And then I would reiterate what Jenny said about building a partnership within the council with key departments that can actually have a role to play here, but also with perhaps community groups and schools, so that everybody's on board to look at what can be done collectively to try and tackle this, and engage with businesses as well. There have been some interesting examples of where local communities, individuals have actually been taken on board as ambassadors to actually promote healthier menu items, and actually encourage businesses to actually go to businesses and say, we'd like to see more of these kind of healthier foods on the menu. And where that happens, businesses are far more likely to respond because the customer's always right. And then I think it's also important to ensure that you have the evidence that you've collected built in very clearly into all the key local policies. So into the council's local plan, into the joint strategic needs assessment and the joint health and wellbeing strategy, so that you've got a clear framework by which you can actually use really to develop your interventions. And if anything is challenged, for example, if a planning application for a new takeaway is challenged, you've actually got some evidence that you can use to counteract that and ensure that the policies are withheld.
So Patricia, just building on that, have you got thoughts about how other stakeholders can be involved?
Yeah, and I think this is where we can bring in schools and children, because consulting with them is really key. One thing we want to do is obviously have them to eat the school lunch, and so one policy would be to have an on-site policy, but actually what we could do is get them to actually go out and have a look at the food outlets, do a bit of an assessment of that, and then work with those outlets in terms of trying to influence in terms of what is being provided there. And as we know, adolescents, they can be a bit fickle, so we want to make sure that what they are provided with is suiting what they want. So actually consulting what's on the school menu is really key. And we found that some schools where they actually mirror the high street, then provide healthier choices on the menu that are the versions of the high street, that's worked really well. Likewise, they want to be able to go and do physical activity at school, so lunch showers are no longer a lunch hour, so they want to be able to have grab and go and then go off and do physical activity, extracurricular activity. So it's really important about queuing and having a cashless system there too, in terms of making sure that they can balance, have a school lunch but also go and off do their physical activity too.
So thank you very much, panel. To summarise, we have lots of evidence here that it is possible to change the food offer in out-of-home venues, and that's a really important step towards tackling childhood obesity, because we know 20 to 30% of the calories children consume are now bought from out of the home. So a few key learnings here. I think what we heard from Jenny is it's really important to go with the grain, to go with a business perspective, and to think about win-wins. How to improve the food offer and how to improve the business. We heard also the importance of the school in this, that there are lots of lessons to be drawn from schools, lots of ways school children and school practice can be used to improve the local offer. And we heard a lot about that actually sometimes there are lots of levers that local authorities and councils can pull. They can think about their licensing agreements. They can think about how they lease their premises and use their power to improve the food offer. And finally, I think the lesson across all this work is we need to think about the whole system. I hope you find the toolkit and its accompanying documents useful. Do please take the time to explore this edition of Health Matters, which includes links to a variety of practical tools, infographics, case studies and blogs. Thank you for watching.